This morning, we are joined by Democratic State Representative Draper of Atlanta. She is sounding the alarm about President Donald Trump's plans to slash positions at the Centers for Disease Control and Prevention, which of course is based here in Atlanta. It is part of wide-ranging plans from Donald Trump and DOGE, the Elon Musk-run semi-public subcommittee, to shrink the federal government. Representative Draper, thanks for being here.
Hi, Greg. Hi, Patricia. So good to be here again.
Yeah, so the news is that about 1,300 or so positions are proposed to be on the chopping block. We know there's been some changes. There's a lot of last minute kind of scurrying around to try to safeguard some of these jobs. But what could this mean for public health?
Oh my gosh, the implications are so wide-ranging. And, as of last Friday, people have been laid off. So that has officially happened. We have, CDC is a large agency, but we have over 10,000 CDC employees here in Georgia alone, a large number of which are in my district in Atlanta, DeKalb. So it's a huge issue, and we're going to see it play out in a couple different ways. There's obviously a very human toll, right? These are people who had stable jobs, right? Who weren't expecting to go in one day and being told you don't have your job anymore. So these are people who are now wondering, how do I pay my mortgage? How do I pay my rent? Do I go on that vacation? So it's absolutely going to have a ripple effect in the economy, right? All the grants, all the programs that the CDC was handling, there's a question as to what is going to happen with those. So again, it's going to have an economic toll. There's a human toll, but there's also this public health toll, right? If you don't know what the avian flu is, thank the CDC, because we are at high risk for the avian flu to really get legs and possible transmission to humans. I mean, we could be dealing with another pandemic. Part of what the CDC does in the public health realm is prevention. They prevent those types of things from happening. Measles outbreaks, E. coli outbreaks, Ebola, right? The reason we don't have Ebola in the United States is because people at the CDC who work in preventative medicine, who work in public health. So if you just go in there and you start slashing jobs without regard for merit, without regard for what these people do, you are potentially exposing not just Georgians, but the United States to outbreaks.
These layoffs, which to your point, have happened, and we have some really great reporting from the AJC's Errol Hart in this morning's AJC exactly who has been affected so far. A lot of people aren't talking. They're worried about reprisals from the Trump administration. So it's actually very difficult to get information about who has been fired, who's been affected, what's that going to look like. But in the meantime, this is also coming on top of a change to the formula of NIH grant funding, and millions of those dollars go to Emory, which works in conjunction with the CDC on a number of things, including cancer research. So this entire research triangle over at kind of east of Atlanta seems to have really been affected, and in ways that it's very hard to unpack right now. You have a press conference coming up on Friday. Tell us what your press conference is meant to do.
You are correct. A lot of people have not been speaking about this. I mean, I can tell you constituents in my district have been very careful about reaching out to me. And I've had a lot of people reach out to me, but it's always, I don't want my name exposed. I don't want anyone to say who I am, because people are afraid of losing their jobs. Again, their colleagues have already lost their jobs. They're being asked to do things that they don't want to do, like remove critical data and information from government websites. And they're afraid that if they stand up and speak out, or if they reach out for help, that there might be layoffs for them too. Right, so there is very much a anxiety around people working at the CDC right now, not knowing what they're going to be asked to do and not knowing if there's another round of layoffs. My intention with the press conference on Friday is to really make the public aware of what is happening, not just with the CDC, but with the federal layoffs in general, and just really connect the dots between what these layoffs mean, both for the Georgia economy, for public health in general, and what the implications could be. The other goal of this press conference is to appeal to our Republican leaders in the state of Georgia, because the silence has been deafening. Now, I like to think about it this way. If there had been a manufacturing plant that opened up in Georgia that brought 1,300 high-paying, stable jobs, you better bet that Governor Kemp would have press releases about this. He'd be talking about it in his State of the State. He'd be coming to the Capitol and publicly congratulating those people for bringing those good-paying jobs to Georgia. But the opposite is happening now. We have layoffs, indiscriminate layoffs, and he has said, Well, he didn't just say nothing. He basically shrugged and said, it happens, right? He was interviewed about this last week in Munich. So the callousness and disregard with which he has approached this so far is stunning, because these are real Georgians and real lives. And again, the economic implications and the public health implications are huge. So at this press conference, we will be appealing to our leaders in the state of Georgia who represent all of us and asking them what can they do to help to keep this from happening in the future.
So Governor Kemp, he addressed these cuts, as you mentioned, in Munich in a Politico sort of sit-down with Jonathan Martin, their senior political columnist, and he said, Kemp said, government can stand a little right-sizing. He talked about, in general, the push here in Georgia to limit the public workforce and the state government, and say that, hey, technology and other changes have wrought more efficiency in state government. What do you make of Republican argument that, that the government should be slashed, and people who think that government efficiency is an oxymoron?
Right. So I think it's totally untethered from what's actually happening on the ground. There may be a place to trim fat, but what DOGE is right now is it's not about government efficiency. It's about government destruction. The way they are coming in here right now and just slashing these jobs without regard for what these people do. They don't have an understanding of what these people do and what the purpose is of what they're offering, right? So they're just making these really broad slashes without understanding, and that's not the way for government efficiency. It's just not it.
Let's talk a little bit about what the nature of these cuts. In Ariel Hart's reporting this morning, she has a quotation from an email that a CDC employee got over the weekend when she was fired, and a firing which her boss did not know was coming either. Obviously, the employee did not know it was coming. Here's what the email said. Unfortunately, the agency finds you are not fit for continued employment because your ability, knowledge, and skills do not fit the agency's current needs, and your performance has not been adequate to justify further employment at the agency. This employee's most recent review included a 4.75 out of 5 rating. So obviously her performance has not been subpar, but these firings have been kind of a blanket chop to certain levels of employees, especially newer employees. Do those employees have any legal recourse at this point? Is there anything they can do? Because this woman now is out of work. She did not have 2 weeks notice. She's done working.
Yeah, no, look, I mean, there are certainly groups that are investigating whether there is some type of legal recourse. And I believe Democracy Forward is putting together a class action to address some of what is happening here. But, those folks who are being this blanket chop, it's not only affecting these newer employees, it's also affecting employers who were recently promoted, so promoted within the last 2 years. So you actually have some very high level employees with very critical responsibilities that are also being let go in these blanket dismissals. And I think that really highlights the fact that this is being done indiscriminately, and that the reasons that are being offered for these layoffs are pretextual.
And we also know there's evidence of this haphazard manner. New York Times reported this morning that something called the Epidemic Intelligence Services, which is, they're known as disease detectives. They were spared from the cuts, but only after uproar from alumni and other officials who just said, please preserve this program, right? That these folks are saving lives not just around the world, but also here in the U.S.
These programs, there's several programs like this within government that attract some of the finest minds from around the world. These are excellent recruiting tools that the U.S. government uses to bring the brightest scientists into the CDC and do the work that only the CDC can do. So I'm very glad that these folks were spared, but we just have to understand that the CDC is full of excellent civil servants who are doing public health work, who are committed to the mission, and who could probably be making a lot more money in the private industry. They are doing this because they believe in the mission of public health. And the fact that we are treating them with such indignity, and that Governor Kemp, didn't even care, right, that these folks were being dismissed, I think it really calls into question what is the purpose of DOGE, what is really happening.
Let's broaden the conversation out to how this could affect people who are not employed at the CDC. It's a relatively small number in the bucket of how many people live in Metro Atlanta. I had an email this morning from a pediatrician, very worried about a potential measles outbreak, worried about whether or not her low-income patients are still going to be able to get vaccines, worried, just extremely worried about what these effects and potential cuts to Medicaid in the future could do to her community. What do you see these CDC effects having on people who don't work there but who do have young children and could be affected by some of these cuts?
100%. So, I mean, this is the ripple effect. This is the ripple effect of public health. And because the CDC is so effective at prevention, we don't see how bad things could be if they weren't good at their jobs. But that could possibly not be the case, right? If the CDC is stopped from being able to do their good work, we might see these kinds of measles outbreaks. We might see a spread in the avian flu to people. We might see a increase in H1N1, right? So, and then at that point, it depends on providers on the ground to have the right diagnostic tools, to have the resources and the information, to have tracking information, right? These are all services that the CDC provides and all supported by grants coming from the federal government. So it's absolutely all intertwined. And the effects, they could be catastrophic. And I don't want to over exaggerate. I don't know what's going to happen in the future. But the fact is, we have elected officials that are meant to protect our interests. And these are the interests of Georgians. And the fact, the callous disregard which this is being viewed, I do not understand it.
We're here with State Representative Syra Draper, who represents, is this still true, the bluest House district in Georgia?
Ooh, I don't know if that is still true with our recent redistricting, but it's pretty close to the top.
It's one of the bluest.
Yeah.
And so we're already seeing Republicans who are pushing to fulfill Donald Trump's agenda at the state level with proposals on immigration, on tax policy. There's even Lieutenant Governor Burt Jones is backing a state-level DOJ committee. Are you surprised by this post-election vibe shift? It was a close election, but it feels like there's been seismic political changes, not just in Washington, but here in Georgia.
Yeah, well, look, if Republicans want to believe there was a mandate, they can say that and they can go too far to the right, and then they will be out of sync with what Georgians actually feel. Because the truth is that Donald Trump won in Georgia by 1.5%. So they can take their cues and try and be in the middle and try to serve all Georgians, or they can go to the far right, try and win their primaries in 2026, but really be in trouble for the general elections after that. And let me go back to this DOJ on the state level. Like, I really, this idea that we can have cuts in government and trim the fat, that is fine. That is fine. But there is a way to do it. There is a process by which to do that. And fundamentally, you need to understand what these agencies are doing, who they serve, right? We're not doing that with what's happening at the state level, with what's happening at the federal level. So if that's what the lieutenant governor is proposing to do at the state level, let's do it. Let's find out where we can make our government services more efficient. I will tell you, however, from being on committees in the legislature, that we have a terrible labor shortage right now. A lot of our agencies at the state level aren't running efficiently because we don't have enough people to fill those positions. So it just, it's insult to injury when you already are dealing with labor shortages, people who don't have employment, and then you're cutting these jobs at the federal level too. You have more people entering the unemployment market, and you have Republicans at the top level who are being mum and not saying a word.
Yeah, on that note, we're starting to see some Republican pushback nationally. The newly elected Republican U.S. Senator in Utah raised concerns saying, hey, look, I like what DOJ is doing. There's a way to do it with compassion. There's a way to do it remembering that these people have lives, livelihoods, families that are affected by these cuts. They don't want to just get an email saying you're out.
And what really, concerns me is as we get deeper into this administration, what are these people at these federal agencies going to be asked to do? There was a resistance in the past to doing things that were at odds with agencies' values. But if people are being fired and they feel like they will be targeted if they stand up, will that mean that there is less of a culture of resistance? I think that's really, likely.
So what is your message now to both your constituents as well as the people from the CDC who have reached out to you? Are you saying just give us some time, we'll get our arms around this, or what can you offer to them in return?
We have to be demanding of our government officials, especially the leaders at the state level, are Governor Kemp, anybody who's running for governor in 2026. We need to demand that they do something about this. These are people that have direct lines to the White House, that have direct lines to Trump, to Elon Musk, and they can be asking that things be done differently. If they are not doing that, it is a lack of courage. They need to be able to stand up for Georgians. And so we need to be demanding that and holding them accountable, because they want to say, let me tell you this. When people were calling Kemp's office to complain about these layoffs, they were saying, call the senators because they're your federal officials, right? Sure, let's tell the senators, and the senators are fighting for us. But you cannot wash your hands of the responsibility of protecting Georgians just because you're a state level official, right? The governor, the lieutenant governor, the attorney general, they're all in positions to say something and do something about this, and they need to do exactly that.
As I mentioned earlier, Representative Draper, you're from one of the biggest Democratic strongholds in the state. Are you happy with where you see the Democratic pushback to all this? Do you think the Democrats are starting to get a cohesive strategy, or is it a state of disarray or disunion right now?
I think we're learning quickly. It has been a little bit of a shock and awe the first few weeks of Trump's presidency. And I think for us, there's been a little bit of a learning curve in figuring out, okay, what do we need to focus on and what can we ignore? What's just white noise? What's a distraction? So as we figure out the things that really matter, and certainly the things that have the most impact on our constituents, we are able to message around them and have calls to action around them.
Do you think these steps by the Trump administration are overreach, or isn't this exactly what Donald Trump promised when he was elected by a majority?
Well, can't it be both?
You
It
tell
can
me.
be.
I think it's both. I think he told us exactly what he was going to do, and now he's doing it. But whether it's legal is to be determined. Whether it's right, I think that's obvious.
I think the question is, do you think Georgia voters will reject this approach in 2026?
I think they will. I think they are going too far. I think the Republicans on the state level are not standing up and not doing what's right for Georgians, and the average Georgian is seeing that.
Yeah, but it's also February 2025, right? By this time next year, there could be 13 other major issues that are front of center, right? Is this something that will stay in voters' minds in a year, let alone a year and a half, when they're actually going to the November ballots?
Well, I think that's part of our job as the minority party, to remind folks of what has happened, to connect the dots between the things that have happened and the leaders that allowed it to happen or did not prevent it. That's our job, and we're committed to doing that job.
Well, thanks for joining us, Representative Syra Draper. We really appreciate it.
Thank you so much.
This is Politically Georgia from the Atlanta Journal-Constitution.